All right, so today we have a little bit of a treat. We have Julie here, who's been doing Orthokeratology for about 3 months now. Before we kind of dive into Julie's Orthokeratology experience, I wanted to just kind of explain to you, or I wanted to just ask you some questions, Julie. What was going on with your vision before you actually started wearing glasses or contact lenses or Ortho K?
Why I started wearing glasses?
Yeah, why did you start wearing glasses?
I noticed that my distance vision was bad. There's things I needed to read for work and whatnot that I was having difficulty. I'd be squinting. I had a lot of fatigue, and I realized I was getting old. So,
well, how old were you when you first started realizing that you needed some sort of correction?
Probably 30.
So a little bit later in life. Yeah, usually people, when they start needing some sort of correction, it's usually in their teens or a little bit of preteens. So Julie's a little bit of a late bloomer here when it comes to the eyes. So you were having problems far away, so that technically means you're nearsighted.
Right.
Meaning you can see technically better up close than you can far away. So what came with that was probably a lot of squinting and maybe some eye strain and stuff like that. So then you started wearing glasses, correct? And how was that process, or how was that?
It was okay. I mean, I'm pretty active, and I've been used to my whole life not wearing anything. You know, up until that point, I was like, oh, carefree. And then all of a sudden, I needed glasses, and the sun would be out, and I needed prescription sunglasses, and it wasn't ideal for me because I'm,
You're
busy.
very active.
Yeah.
Yep. So then you kind of danced around with the option of doing soft contact lenses, and what were your thoughts with that?
I actually really wanted to do contact lenses, but it was super abrasive on my eyes. Like, my eyes constantly felt itchy, and I would end up taking them out halfway through my day. And I'd be like, where's my glasses now? And it just was not ideal, and I didn't know why it was so. I tried probably every different type of contact lens that they had. Single, dailies, weeklies, monthlies, everything, and none of them worked. It just was too irritating.
Yeah. So you wanted the luxury of the contact lens look, or the freedom of it, not being constricted to glasses because you're active, but you couldn't handle the soft daily lenses, correct?
Yep.
So then you heard about Orthokeratology, and what was your first thoughts when you heard about Orthokeratology?
I was excited because one of my friends, she had Ortho K, and she had the same issues as me. Her eyes would be irritated after a full day, and she said when she got it, she's like, oh, it isn't like that because you wear them at night, and it's just a little bit different. So I was excited to try. I wasn't very interested in doing any sort of surgery on my eyes. That just kind of freaks me out a little bit. So I know a lot of people, that's an option for them. That wasn't an option for me. I'm like, and plus I know your eyes change a lot, and so I'm like, this sounds like a good option for me. It's something I'm not scared of.
And I've always said, I'm a huge fan of LASIK. I'm not against LASIK at all. LASIK is a fantastic option for some people, but not everybody wants to have surgery. And so Ortho K, that's where Ortho K kind of comes in, because it is a contact lens that you wear while you sleep, and it corrects your vision overnight. So when you take them out in the morning, you can see all day without contact lenses or glasses. Okay, so you've been 3 months into it.
Right.
And can you explain to me really what the process is like? I mean, I tell patients what it's like, but I want to hear it from a patient's perspective.
I would say it's been very easy. I thought it'd be worse than it had been, just because of my bad experiences with contacts. But it's been pretty, I'd say, seamless. There was a little irritation at first at night, but that's because it's new to me putting it in, and it was a hard contact lens. But nothing like, it was so irritating. It was just like, oh, I can feel it's there, and then I'd shut my eyes and it was fine. Taking them out and putting them in was kind of a challenge, just because I used to just muscle the ones, the soft contact ones. I mean, you're going in, where these ones, it's
a little more delicate.
Right, it's a little more delicate. But I would say the learning for this was the curve was very small. I didn't have a whole lot of issues, and I don't think I called you that hardly at all. Only at my on my appointments was I making contact, because it was very easy, I thought. I mean, if there was anything, it was learning how to take them out. But that was just a small window of difficulty.
Yeah, there is a little bit of a difference between the soft daily lenses and a hard Ortho K lens. Like you said, with a soft lens, it is a little bit more forgiving. If you put the lens directly on your white part of your eye and move it forward, it's a soft lens is more forgiving in that regards. Whereas with the Ortho K lenses, it's a little bit more little bit more precise on where you insert it and how you remove it.
Right.
Okay, so you're 3 months into it. We just did your evaluation to see where you're at, and you are 2015. You got all 5 on the 2015 line, which is fantastic. That means she's better than 2020 without any sort of correction on. Is orthokeratology something you'd recommend to your friends?
Absolutely.
Okay.
Yeah, I tried to talk my husband into it, but he wears soft lenses very easily, and he's older, so he's like, at this point, I'm stuck in my ways. But for the people that are kind of, like I said, had what I had, where all of a sudden you're middle-aged and you're not used to anything like that, this is perfect. And it's when you sleep, so I think it's pretty ideal.
Yeah. Well, and once again, there are options including soft lenses, LASIK, and orthokeratology is in that mix too. So it's not like you're stuck to one option that you have to do only. If you could sum up orthokeratology 1, 2, or 3 words, what would you say, Julie? Not to put you on the spot, but
in 3 words, if you're thinking about it, I would say just do it. So, because I'm glad I didn't wait. Like, I came in here for a appointment, and I think
just a consult, basically.
Like within the week, I made the decision, and I'm glad I didn't. Like, I get to wake up in the morning, I can see at far distances, and it never was an issue where I was blind because my vision wasn't that bad, but now I can see things, and I live out in the country, so it's like I can see what's going on at the distance, and it just, I can wear, I was talking earlier, I can wear whatever sunglasses I want now.
Without any prescription or losing your nice prescription sunglasses,
So it's just, I think I am glad I didn't. I don't regret one bit of it. So.
Well, that's great. Well, you heard it here from Julie. Julie's 3 months into her orthokeratology experience. Find out what it's like to be contact lens or daily contact lens free, or experience a little bit of clear vision without any sort of correction on, without having to go through LASIK or the cost of LASIK. If you'd like to learn more, you can follow us on our YouTube and our Facebook page, where we have many more testimonials. My name is Dr. Theodore Sears with Rockford Family Eye Care, and we'll see you next time for your video testimonial.